welcome Dr. Samantha Pfeifer from Weill Cornell in New York. How are you today?
It's wonderful. It's good to see you again.
You too. It's been a few months since we last spoke, and we've got a couple of great topics to cover today. So could we start by talking about preparation for embryo transfer in terms of what people perhaps might be worried about that is out of their control, and what people can do to benefit them before they have a transfer, whether that's frozen or fresh?
So I think everyone really focuses on that a lot because it's one of the few things you can control. And this process is, a lot of it is out of your control. So I think people think a lot about um, when they have something that is in their control, how can I optimize it? So I think thinking about it as an important step in the fertility process, of course, but I think it's always good not to stress about it because, the plan is to put embryos back in the uterus, and the actual transfer is typically not that difficult. Um, Many people do ultrasound guided or without ultrasound guidance, but either way, the embryo or embryos are going back in the uterus. And so that part, you really don't have control over that process. But leading up to it, what are you supposed to do? And I think the main philosophy is just live and try and be calm and try and be happy. So what that entails is making sure that you're reducing your stress. You're getting some exercise. Now, typically we don't want people exercising a lot, but I think moving around, walking, even if you've had a retrieval, doing some walking is very helpful. And if you're having a frozen embryo transfer, we've not had a stimulation beforehand, going out and walking a little bit to clear your head and helping reduce stress, I think is important. I think eating healthfully, making sure you have a good diet, or getting a good night's sleep. But if you don't get a good night's sleep, it's not the end of the world. It's not going to ruin everything. I think if people focus on, are there certain foods I should eat? No. Eat foods that you enjoy, that are good for you and make you feel good. You don't want to go crazy eating something. As no one has ever shown that eating, say, pineapples continuously before the transfer is going to help. I think certainly healthy food is important. But the other thing is, don't feel guilty if you've done something that isn't totally healthy or you didn't sleep at night. Those things, it's not going to help you to stress about that. It's life. With IVF, we're controlling everything and regulating everything so carefully that your body really, it's very difficult for your body to do something inappropriately. And so a lot of these things, we think of a lot of these things can disrupt your cycle. So exercising too much or not eating enough or doing things like that can disrupt the cycle. But for a lot of these transfers, the cycle really has very little to do with it because we're manipulating the hormones. In natural cycles, we're supplementing. So it really is not terrible if you don't sleep or if you're not eating healthfully in the days leading up to the transfer.
Mm-hmm.
So really thinking about that from a very common sense way, and just sort of having it as another day and trying to minimize external things you do. The other thing is I wouldn't do anything new. Don't change a winning game. So don't do something different in the days leading up to the transfer or even before the transfer, because if something doesn't work out, you're going to find a way to blame yourself for doing that. I don't care what it is, you will find a way to say, oh, if only I hadn't done that, it would have worked. So try and minimize variations in your routine and just do things in a very calm and steady way. And that's really the best way to prepare. In order to get to that point, your doctors and the care team has really manipulated everything to a really fine degree. And if anything, they see anything that is not consistent, then they may not opt to transfer, which is to your benefit. You don't want to, put an embryo back when you're not ready. But a lot of that is being taken care of, and there's very little you can do to disrupt that. So I think just putting yourself in a good place is actually very important.
Amazing. Yeah. I remember when I was in New York about to have a frozen embryo transfer, I hadn't been drinking for months. And my sister was with me to keep me company, and my husband had to go home for work. And we went for lunch, and I ordered the wrong thing because there was obviously a difference in understanding of the menu. And so when I took a huge gulp of this drink, it was filled with tequila. So I then thought, oh my goodness, this is definitely going to fail because I've just had some alcohol. What am I going to do? And my sister just kept saying, relax, relax. It's not going to affect anything. And that actually was the time that it did work. So that anxiety was momentarily unnecessary. It just caused a lot of stress and a beating heart.
Yeah. I mean, I think, something like that is fine. I think we would not encourage people to go out and get totally smashed right before transfer, but, that's unlikely to happen anyway. But I think that, having a glass of wine, there's nothing to say that that would prevent implantation.
Mhm.
So I think, again, being smart and being a lot of common sense in that is really the best approach.
And why is it advised to have a completely empty bladder for the retrieval?
So with the retrieval, you're putting a needle through the vagina into the ovaries. And if the bladder is full, then that can push the uterus out of the way and make the ovaries further away from the top of the vagina. And then the bladder is more likely to be injured because it's bigger. With a bladder that's decompressed or empty, it's much smaller and it doesn't push the ovaries out of the way and doesn't get in your way when you're trying to get the eggs out of the ovaries. So that's why we want an empty bladder for retrieval. And in contrast, a full bladder for transfer is what many programs advise. And that's basically, I think, for two reasons. Number one is if you're going to have an ultrasound guided transfer, it allows you to do a transabdominal ultrasound to visualize the uterus, and it's much easier to see the uterus if the bladder is full.
Mhm.
The other is that in a woman with an anteverted uterus or a uterus that's tilted forward, if you have a full bladder, it flattens out the path from the cervix to the uterus, and so it's a lot easier to get into the uterine cavity. The third reason, which I think of, is that if you are having difficulty in performing the transfer, then you can always do an ultrasound guided transfer. And in that preparation, it's nice if the bladder is already full, because otherwise you have to stop, have the woman go drink to fill up her bladder, and then come back to the transfer room to have a transfer. So I think there's really three reasons that I find it's very helpful in my practice, and a lot of practices are doing that same protocol.
Mhm, mhm. I remember just in the waiting room for that, just everyone just taking trips to the water fountain to fill up their glasses again.
Well, it's funny when we transitioned to doing a lot more ultrasound guided transfers, patients who had been previously, before we were doing ultrasound guided transfers pretty routinely, like, why do I have to have a full bladder? I've never had a full bladder before. I'm like, okay, we're doing ultrasound guided transfers, and it really helps with that. And it was funny to, any change can really upset people. And like, what do
Mhm.
you mean I'm doing this? So it's kind of funny, but I think it's really for some people, it's really a very, very helpful strategy to have an ultrasound guided transfer. It's not always necessary for everybody, but certainly in some people it can be very helpful.
Okay, great. And what about acupuncture as well to support that period?
I mean, I think that acupuncture, and I don't really understand much about acupuncture. I respect acupuncture as a adjunct to Eastern medical care or Western medical care, whichever is the one that's not the acupuncture. I can't remember. But acupuncture is great, and I utilize acupuncture for a lot of my other patients for other things like migraines and pelvic pain and all sorts of other things. It's incredibly helpful. The thing that acupuncture works by being a slow and steady process. It's not a quick fix process. So acupuncture has, if the studies looking at acupuncture and its benefit with regards to IVF success rates have not really studied it in the way that it's supposed to be administered, in that some of the studies have just used acupuncture in that cycle to say, does it help or not? But that is using it as a quick fix. Acupuncture is a therapy that goes over a long period of time, and no one has really studied the effect of acupuncture in the way that it's supposed to be administered. So that's one of the issues. Having said that, the studies have not shown that acupuncture is helpful, but no study has shown it to be detrimental. And I think that we don't really know. I don't understand how acupuncture is helpful, but it has so many other effects. And many patients say they just feel calmer with the acupuncture. Many patients really feel that it helps them from many other physical and emotional ways. So I think that it's an adjunct that for those patients that are interested, I encourage them to use acupuncture, but wouldn't make someone, have acupuncture if they were, hesitant or unsure about pursuing that. But I think it's a nice adjunct. I really do.
I guess, as you said, it's about relaxation and mindset, isn't it? It's like ticking those boxes. If that's for you and you feel like that will make you feel more comfortable, like you've tried various other things to support what you're doing, then that can be a good thing for your mindset. So
Yeah.
for me, it helped me fall asleep. And I really wanted sleep, and it just relaxed me. So that's how I found it beneficial. But I guess that's not for everyone at all. And
And I think there may be other ways that acupuncture is beneficial. I really don't understand what they are, so I can't comment on that. But I respect it as a practice. I really do.
And in terms of the 2-week wait after the transfer, what would be the main things? I mean, a lot of it's common sense, but what would be the main things that people should avoid? Because I know it can get obviously it's a very worrying time. The days drag on. You're waiting for that test. You want it, but you don't want it. So what's your advice about that?
Well, first of all, I had to laugh because when you emailed me about talking about these things, I'm like, okay, embryo transfer, I understand that. And what's the 2WW? I was so confused. So now I understand that's a 2-week wait. But
Yeah.
I just think doing your best to keep even-headed. It's a really difficult time for a lot of patients. Your transfer date. You know that this is your pregnancy test date, and you've got a lot riding on it. I think do everything you can to carry about your normal life. Do everything you can to keep your steady routine. Don't change a winning game. Don't start a new activity. Because most of those things, I always prepare for the worst case scenario. If it doesn't work, you're going to be quick to blame yourself about whatever you did. That's human nature. So I think that avoiding anything you can beat yourself up about is really a very good thing. And then, measure distractions, things that can keep your mind off of it. I think, we all read a lot into what our body is feeling. And, I think with IVF, it's very difficult because you're taking a lot of medications. And for some people, they're taking estrogen patches or tablets in addition to progesterone. They may have had an HCG trigger with a fresh IVF cycle. So there's a lot of other hormones in the body, which are, adding sensations, I should say. They're not really side effects per se. But so you feel things, and it's hard to differentiate, is this the medications or is this something happening? And I think, it's very difficult to try and sort that out. So I think not paying attention to your body so acutely can be helpful because your body is not necessarily going to tell you if you're pregnant or not. And we've seen patients come in tears saying, I feel nothing, I can't be pregnant, and they're pregnant, and people saying, oh, but my breasts are tender, I'm feeling this, I must be pregnant or not. So I think that can make it more challenging when you get the result. And I think just preparing for the worst case scenario, because you don't want to have a big crash when you assume that you're pregnant and then you're not. That can be so devastating to have that crash. So I think cautiously optimistic and being positive is really important. You know what you have in there. You have embryos in there, an embryo in there, and you've got to be very positive about that. And just do things that can help you reduce your stress and keep you calm during that time and help you manage expectations and have reality check on, this, I have to believe this is going to work. But if it doesn't work, you help protect yourself. So those are things I think are important.
I think for me, it was about having a plan. So if this doesn't work,
Yeah.
what's going to be the next step? So that it's not something to look forward to, but you just know that you've got something
Yeah.
arranged or in your head about what might happen if it doesn't go the way that you want.
Yeah. I think that's actually my mentor, Dr. Luigi Mastriani. He really impressed that upon me. It doesn't matter what's going on, but if a patient had a game plan, everything was going to be okay. And I think that's really critical. I think also when you find out the test is negative, it can be very difficult to then at that point formulate a plan. You need some time to really um, adjust and to recover from that negative test. And I think, either having a game plan ahead of time or setting up, if it's negative, I have an appointment to talk with my physician or my care provider at a specific time can be helpful, because you need to, adjust to the negative, and then, okay, I have a game plan to talk about what the next steps are.
Mhm.
So I think, having a definitive timeline and a point to contact, to be contacted by your provider is really important, because you need something to aim towards.
That's really good advice. And also, when a round doesn't work, it can be really hard to not blame your body as well.
Oh yeah,
Mm.
and people blame themselves about the silliest things, and
Yeah.
I do it myself. I'm not saying it in a judgmental way. I mean, oh, I didn't look I didn't look to the left, and I should have looked and noticed that. And it's like, stupid things.
Hmm.
Yeah,
Hmm. I remember taking a test early, which obviously you would advise against, at home, and it not working. And obviously I needed to continue the progesterone until I'd had the blood results, and just not caring the way I was before. I can't remember whether it was ice or keeping it warm, I can't remember, but just shoving the needle into my buttocks because I didn't care about the pain, because I was so angry with my body, just in
yeah,
floods of tears, just
it's
so
hard.
angry.
It's hard. I think, and it sort of points out too, as you go through the process, having a good care plan for yourself, having a good care plan for, a partner, and just knowing that you've got your emotions protected, people that you can rely on, or a strategy for coping with a negative result is very helpful.
Hmm.
So I think that those are things that are really important. It's important to think about that and set that up ahead of time, not to be pessimistic, but just say, okay, how can I protect myself during this time? And that's a time you really need to care for yourself and make sure that you have set aside time and you have adequate time for rest and relaxation and some physical activity, whatever that may be. But those are really important things to take care of yourself and not be running around like a crazy person if you can avoid that.
um Thank you for that advice. Just quickly before we finish, going back to the period of waiting to take the test, one of the things which I think I was advised not to do, and that was really hard for me because it was summer in New York and I was staying with a friend who'd flown out in an amazing hotel with a rooftop pool, was not to swim. Is that true?
Yep. I think that for a couple reasons. So, first of all, we don't want anything in the vagina that is, foreign. So any swimming pool, you jump into a pool, there can be a lot of water that goes into the vagina. And then the question is that going to risk infection?
Hmm.
So we don't want that to happen. No baths, the same thing. And so I think that those are things that we tell people, sort of with blatant disregard for, okay, it's 110 degrees outside and you're dying
Yeah.
of heat.
Yeah.
But the other thing is we really don't want people jumping around. And what do you do in the pool? You jump around, you jump into the pool, you move. We don't want those ovaries flipping around, because that can increase your chance of having torsion or cyst rupture or something of that nature. So it's kind of twofold. Um, I think that, how likely is it to have water into the vagina if you're sleeping, standing in the pool? It's one of the things, just, we don't want to take any chances. There's so much invested in this. And so that's really what that recommendation is based on.
Mhm. Again, going back to your point as well, if you're going to beat yourself up about it and look back on what you did and didn't do, for me, it wasn't worth the worry,
Yeah.
versus the momentary enjoyment. Um,
I, I see that a lot. People say, well, can I do this? Can I do that? I'm like, okay, if it doesn't work, are you going to blame yourself for that? And
yeah.
like, oh, yeah, I would. So then don't do it. Like, take it off the table.
Hmm. Yeah.
Absolutely take it off the table. It's not worth the stress, because human nature is to blame yourself about everything. So,
Hmm. And the last thing I want to ask you, please, is
yeah.
one reader has asked whether you mentioned symptoms or no symptoms and not reading into it, but if you're looking out for, say, implantation bleeding, or you are bleeding during that time, is that indicating anything, or is it something to not look into?
I mean, I think we always say there can be implantation bleeding that happens about a week after you ovulate. It's really doesn't happen that frequently. I think that there can be some slight staining that can occur that may be normal. I think that most people who've gotten to the point they're having an IVF embryo transfer, their cavity's been evaluated and it's clear that there's no polyps there, anything that's abnormal there. So I think it's really hard to understand that. I think if the bleeding is if it's bright red blood, then you should contact your care provider because it may be something different. I wouldn't assume that. But staining can happen. We really don't think much of it. It may not be implantation bleeding. People often assume that any bleeding they have at all could be implantation bleeding. Sometimes if you've had a fresh transfer, there could be some, little bit of bleeding from the retrieval, and that can be there too. So I think if it's bright red blood, that's not typical. If it's a little pink staining, that may not be abnormal.
And what about cramps?
Cramps are so hard. I think that any cramping that's in the lower abdomen, people assume it's the uterus, but oftentimes it can be the ovaries, especially if there's been a fresh retrieval. Oftentimes it could be bowel, and it's really hard to differentiate cramping from bowel versus ovaries versus uterus. And it's really difficult to, even people that say, I know this is my uterus. Yeah, it may not be the uterus, it could be the ovaries. So I think, cramping, if it's mild, is fine. Certainly in early pregnancy, there is a sensation of cramping that is accompanied by no bleeding, and that is a typical symptom of pregnancy. But it's hard to read into that if you're in that 2-week period where you can't find out if you're pregnant or not. So, I think that I wouldn't put a lot of importance to it. I wouldn't say it's bad. I just sort of note it, but I wouldn't assume it means anything.
And would you say yes, good advice. Would you say that people should hold off testing before the date they're given because it could be false?
Oh, you can't do anything until you get the blood test back. I mean, for some people it helps them to test early. For some people it doesn't. I would just go with what you think, but I wouldn't, I would not stop any hormonal therapy based on a urine test. I would only do that on a properly timed blood test. So I think that, I wouldn't use those as a definitive answer as to if you're pregnant or not.
Mm-hmm.
Yeah, blood test is more accurate. And I never forget, we had a patient come in years ago, but she was sobbing because she had a negative pregnancy test, yet when we did her pregnancy hormone level, her hormone level was over 100,000 and she was like 8 weeks pregnant. And her test was so positive that it oversaturated the receptors in the urine kit, so it read it as negative. So I don't believe a urine test is a definitive answer.
Gosh.
Yeah.
That's a really
So, just always, just make sure you know exactly what you're doing. You've invested so much time and energy in this, you don't want to stop things prematurely and have a problem that you could have prevented.
That's great advice. Thank you so much for today.